edorders is a web-based tool you will use to document the patient encounter. This includes any procedures performed in the ED. The information from edorders is then transferred to Meditech, which is the hospital's electronic health record system. You will work with several different physicians during your time as a CarePoint scribe. edorders will allow you to search and access each physician's personal preferences. It is your responsibility to review and follow these preferences for each physician you work with. Note there are 5 chart templates: general adult, cardiac, GI abdominal, neuro, trauma, and pediatric. You will choose a template based on the patient's reason for visiting the ED. So, if a patient is visiting the ED for chest pain, you would use the cardiac template. You will use the general template for all other complaints. The edorders chart is broken into sections. In the demographics tab, you will document the patient's room number and primary care physician. If the patient arrived to the ED by ambulance, there's a spot to include details such as treatment or medications provided to the patient by paramedics. In the HPI tab, you will always document a chief complaint and history source for the patient encounter. There is a box to write a free text HPI, or you can use the clicks in each section to build the HPI. It's important to note some providers prefer more free text and others prefer the clicks. Regardless if your HPI is mostly free text or clicks, to write a compliant HPI, you are including key details: timing onset, duration, severity, location, quality, modifying factors, associated symptoms, and any other relevant contextual details. If you're using the clicks to build the HPI, click the button once to indicate positive and twice to indicate negative. Here's an example. A patient is visiting the ED for chest pain. They report the quality of their pain as sharp, but not burning, and worse with movement. They also reported improvement with ibuprofen. Notice ibuprofen is not a click option under modifying factors, so that piece of data is free texted. Buttons are structured the same way in the ROS tab. Red line documents symptoms as negative, and blue documents symptoms as positive. It's important to note that scribes need to document the review of systems very carefully, ensuring positive and negative symptoms are not conflicting. For each organ system in the PE tab, normal exam findings are listed on the left and abnormal exam findings are listed on the right. Notice the clicks under the eye section. The patient has normal conjunctiva sclera and they are negative for scleral icterus. It's important to note that scribes need to document the physical exam very carefully, ensuring exam findings are not conflicting. For example, if scleral icterus was clicked blue, meaning the patient is positive for scleral icterus, that would conflict with our button click reporting a normal conjunctiva and sclera. The procedure, EKG, risk, reeval, and consult tabs provide various elements to document treatment and care provided during the patient's ED visit. These sections of documentation will be discussed later in training. From the Summary tab, the edorders documentation is copied and pasted into Meditech, the hospital's electronic health record system. It's important to note throughout the patient's visit in the ED, you will continue to update and edit documentation for the patient encounter in this free text window. Now, we'll discuss documenting a procedure note. To return to the edorders home screen, click on the edorders logo. On the right-hand side, there are several procedure macros. Select the procedure note you want to document. To build a procedure note, click the buttons the same way you build a chart in edorders. The procedure note is then copied into Meditech.